everyone. A very warm welcome to you today, and thank you for joining me for the short presentation workshop on caring for your clients navigating infertility. Over the last 10 years, I've always had a passion for supporting clients with fertility and throughout their pregnancy and beyond. It wasn't until I had my own personal struggles with infertility that I realised I really didn't understand my clients' experiences. This workshop looks at the mind, body, soul effects of infertility and the self-help methods that you can provide to your clients, supporting your clients mentally, physically, whilst navigating their journey. So I'm Gemma Mavroulakis. I trained well over 10 years ago in complementary therapies, massage, reflexology, aromatherapy, went on to do many different courses and run my own business. I've now been training for the last 6 years and specialise in just teaching certain areas that I feel more passionate about and that I have more experience within, and also really good results with my clients. So one of those areas being pregnancy. So like I've said, I've throughout my career, I've always supported people on their pregnancy journey and also supported many people with infertility issues. And myself and my husband have been trying for now for 5 years and have had a completely up and down journey. I'll share my personal experiences with you to try to allow you to better support your clients. So yeah, the 1,613 is how many days we've actually been trying to get pregnant. Let's get started. Let's look at some of the research and the facts around infertility. So infertility is a global health issue affecting millions of people with reproductive age worldwide. It affects 1 in 4 couples in developing countries, and about 48.5 million couples are experiencing infertility worldwide. That's a massive, massive number. And infertility rates are always on the rise. There was a study done in 1993, a research study that actually, which I found absolutely fascinating. It wasn't until being on the journey that I actually became aware of this research. The research was set to compare the psychological symptoms of infertile women with patients of other chronic medical conditions. All of the subjects were female, and the totals of the people participating in this study, there was 149 with infertility, 136 people with chronic pain, and 22 females undergoing cardiac rehabilitation, 93 with cancer, 77 with hypertension, and 11 with immune deficiencies such as HIV. The infertile women had a global symptom score equivalent to those of patients that were affected on a psychological level with cancer, cardiac rehabilitation situations, and hypertension. Had a slightly lower score than chronic pain or HIV patients. But the results suggest that the psychological symptoms associated with infertility are similar to those associated with serious medical conditions. Therefore, it's really important that we look at different interventions and actually start to treat people that are undergoing fertility treatment or that infertility journey. It's really important that we start to see them and treat them of people that are that are going through a massive amount of emotional and psychological stress and impact. Now, I think it's really important to be aware that a lot of the studies that I've done tend to be more when people have been struggling for over a certain amount of years, so 2 to 3 years plus. So like I say, I would technically fit now into that bracket of trying and being on this fertility journey for 5 years. There's some people that may be on the journey for 6 months to 12 months, and everything that we're talking about would still be really relevant to them. But those people that are having a higher psychological impact is going to be the people where it's been happening for a longer period of time. So infertility is actually classed as a disease, and its treatments affect all aspects of people's lives. So when I start to break that down, it has a massive impact on people's relationships and marriages. Tests on your marriage, can be really challenging. Also, if you think that, say, if the issue lies with one person, not the other, that can create a lot of issues. There are lots of relationships and marriages that, break down through the impact of infertility. Work or job, it can have a big impact. But me personally, being actually treating people day to day with treatments, I've had to take a little bit more of a backseat and step away from that, just because I felt that this situation is so overpowering sometimes that I'm not actually able to have that extra energy to give to anybody else other than giving to myself in that time. And just your job satisfaction, with a low mood or feeling more depressed, that can really start to impact how much you work. And a lot of people do actually find that they end up giving up work that are on an infertility journey because they just can't cope with everything. So a big impact in your work and your job. Then spiritual, religious and core beliefs. It really rockets that from on a personal level. It's really rocketed that for me because it's, I always believe everything happens for a reason. But when you have a failed round of treatment, you can't help but question those beliefs. Why is this happening to me? And why is it that I have to go through this again? And, at a time, I know it's easy to say it, at a time when you are struggling and those spiritual religious core beliefs are the ones that carry you through, it still doesn't stop you doubting it. And, and when something really rockets your core beliefs, that can have a massive impact to just your core purpose of life, what drives you, and can really push you into a big negative hole really of depression and emotion. Yourself and the emotional impact, we're going to look at that in a little bit more depth. Financial as well. Us personally, after being in this journey for 5 years, it's cost us over 20,000. There's treatments available on the NHS, but a lot of people don't qualify for those treatments. It depends on the area that you live in and the services that are available to you, and also the criteria that you fit into. So it doesn't necessarily mean that NHS is potentially an option for people with infertility. External family and relationships. Again, I've never had anything that's really rocketed that and impacted my core relationships with my friends and my family. You get to a point where you feel like you're almost letting your core family down because, you're not able to provide them with a grandchild or, things like that. So that can have a really big impact. Also, because a lot of family members don't understand the journey. It's really difficult to fully understand it unless you're actually going through it. So it can be difficult for them to understand, and that can then impact those relationships. Also, if you're borrowing money from family, that again can have an impact. And external relationships, like my core relationships with friends, has been really rocketed when they've been expecting their own children. I haven't been able to, be there for them as a friend because it's too triggering, too painful. So I've definitely lost friendships over this as well. And different things that people say. I went through a situation a couple of years ago where I had all 3 of my bridesmaids all pregnant at the same time. That's a massive impact on somebody that's going on this journey. Okay, so we're going to look a little bit more about the emotional impact. So I often think that people think, oh, once you've got a child, the emotion goes, or, that ends. But That may be the case for a small number of people, but for a lot of people, this situation is a trauma. That is what you're dealing with. Like similar to post-traumatic stress disorder. Once those, you maybe have slightly overcome that, it doesn't mean that the trauma is going to go away, and you can be impacted from that for a long period of time. So what it's trying to look at with your clients is, helping them to realize that, giving them some, consolidation, giving them some recognition around the trauma that they are going through, and helping to give them that understanding. And just giving them some validation around that as well. So it can just help once you have that awareness of how much it is emotionally impacting you, and how big of a deal this really is. You can start to be a bit more aware of potential triggers. So I've got here a list of the emotions around it, potential triggers, but just a few things that I feel that have supported me to spiritually grow. So emotions, the biggest one is grief. It's a really, really deep, painful grief that people will go through. And I always say that, on the infertility journey, every single one of your clients is, if you're working with a lot of infertile clients, but every single one of these clients on the journey isn't necessarily going to be at the same place at the same time. So it's really hard for them to kind of find some kind of community around that. So one of the main emotions that people will say will be loneliness or isolation. And that's because it's really hard to find somebody in the exact same situation as you at the exact same time. It's not very comparable. So what is comparable is their emotions that they've gone through, that emotional growth and learning that they've gone through. So this can then be what helps you as a therapist, to understand that more, because these may be similar emotions that you may have felt through periods in your life or through certain situations that you may have been through, and that can be more relatable than the actual physicality of the fertility journey. So a really, really deep feeling of grief. Worthlessness, it can affect a lot of us regardless, but that feeling of feeling worthy, something that your body is meant to do, and you're not able to do that, and like a complete lack of control. Pain, physical emotions, anger, resentment, sadness, depression, anxiety, like we said, loneliness, inadequacy of I'm just not feeling good enough, a hell of a lot of fear as well. So you think if you've had one failed round of treatment, how much strength is needed to even be able to put yourself potentially through that again. There is so much fear that can come into it as well. Guilt or regret for past situations, or maybe not doing things the way that you would have hoped, and just an overall feeling of just hopelessness. So potential triggers for our clients that are on this journey could be pregnancy announcements. I would say that most people that have been through the journey would say that was probably one of the top things that would be a trigger for them. Being around a pregnant person, baby showers, social media as well. Saying the wrong things, so people saying the wrong thing to you can be a really big trigger. Negative test results, obviously having negative treatment, cancelled cycles, failed treatment, or miscarriages. So any one of those things can be a really good big trigger to the emotions. So it may be that people are able to function day to day, and then they see something like that, and it just brings them straight back down to really triggering that deep rooted emotion. Spiritual growth. So some of the things that I feel that I've really positively learned from this situation would be patience. Like I say, something that's completely out of your control, letting go to be able to find that patience. And I think that you can really help to find that patience through acceptance. Once you can start to try to accept a situation that it can't be changed, or this is the situation that you're in, patience can come. Finding out who you really are, finding actually how much strength you may have, hope and will. I've never really been through a situation that's really tested my willpower and my strength. And that surprised me. It's a lot better than what I thought. So this could be the same for your clients, and to home in on what it is that they've grown, like they've learned and grown from this experience. Like just a true love, to appreciate that love with your partner. I'm lucky enough in my relationship to have a deeper connection with my husband through this. Obviously it's had its up and downs and its challenges, but as the time has gone on, it's definitely brought us closer together. So some people will find that. Courage, just having the courage just to take the next step. When you know that the outcome is a 50-50 chance of being extremely painful. Trust as well. And faith, like I said, it can really impact your faith and make you question it and make you doubt it. Especially, again, in my situation, being a therapist and helping other people on the journey, and helping others to get pregnant, and then going, oh, but I can't do that for myself. So that really tested my spiritual faith. But as time's gone on, I feel that, that's got stronger as well. So I just want to bring it now back down to basics. So we've looked at the research, that emotional impact, and what could really be going on for our clients deep down that they may not be able to communicate or potentially share with us. It can just give us that better understanding of what can be going on deeper for them on a deeper level. But on a more physical level, what is it that they could be potentially going through? So there's a mass amount of causes of infertility, and it affects men and women equally. Generally, you're going to be looking and working with the female energy within this. 25% of infertile couples have more than one factor that contributes to their infertility. The main factor to consider is the sperm health, the egg, so the egg quality, and the environment, the uterine environment. So there's a mass amount of causes, but these are just a few to list. So you've got things such as toxins, smoking, alcohol, oxidative stress, age. So age can have a big impact on AMH levels, which are the levels of what your ovarian reserve is. So that figure that is a blood test that can be done that can give somebody it gives a practitioner a good idea of how many eggs are reserved within that woman. So we're born with a certain number of eggs, and we do not produce any more eggs throughout our lifetime. So there we do have a natural body cycle with that. So the AMH just helps to just test that level. You can have, it can affect poor egg quality. So the lower AMH that you have, that can impact and say that the person may not have many eggs left. But also then you've also got the quality of the eggs. So age, as somebody gets older, it impacts on the quality. Age can impact on the sperm quality as well. And primary ovarian insufficiency is when somebody basically, for their age group, doesn't have a sufficient amount of eggs to even be able to get pregnant. You've got mass amount of hormone imbalance as well. Lifestyle, you've got stress, over-exercising, being overweight. Particular related conditions as well, polycystic ovary syndrome, polyps, blocked fallopian tubes, heart-shaped uterus as well, where they've got the separation at the top, can really impact somebody's fertility levels. Immunity factors such as high level of natural killer cells, autoimmune disease, endometriosis, and pelvic inflammatory conditions as well. So there are different things that that can be done to help a lot of these factors, but just getting to the point of the cause of infertility in a lot of couples can take years. And sometimes it isn't actually until they have many failed rounds that they can, practitioners can actually, and the doctors can actually start to look at it and go, oh, okay, maybe that could now be an immunity factor that we need to look at. So a lot of these don't necessarily come up straight away, or the person knows about it. The person could have been going out throughout their whole life, not being aware of this. Bacterial or viral, so such as STIs and microbiome imbalances and infections, genetic disorders, so chromosome abnormalities. So we've got a list of different ones there as well. So you can see that, like I've said at the start, there isn't really one factor that can be contributing to infertility. And then if we also look that when somebody is on that journey for a long period of time, and we look at all the emotional impact, then what can that emotional impact also, how can that also affect your body? I'm a massive believer in the mind-body connection and how our emotions portray through elements within our body. So if you look at the emotional factors, that can then also have a bigger physical impact, say on the person's stress levels, on how much weight, how much they eat, how much they want to drink, how much oxidative stress, and that can in turn affect a lot of other symptoms. One that I find really interesting here is the microbiome imbalance. So personally, just again with my journey, I had no symptoms, was carrying on with life, and I didn't realise, I used to take a probiotic every day for the gut, but didn't realise that the vagina holds a different microbiome balance, and there's different bacteria that are key for the vagina health. So I actually had a test done, and it came back that I actually had, you're meant to have 90% good bacteria and 10% of bad bacteria. Mine actually came back over 90% with bad bacteria and only 10% good. So my environment, like we said at the start, the sperm, the egg, the environment, my environment wasn't a healthy environment, even though I wasn't aware of it. So it's good for you to have just a bit of an oversight into potential causes, and it may be something that you want to do further research into each of these conditions, just so you can have a better understanding. Like for example, natural killer cells actually stop somebody from getting pregnant. If you have a certain more natural killer cells within your body, it can actually kill off the embryo, so it can kill off a fertilized egg and stop it from implanting. So and lots of people do actually have this condition, and when they're on the fertility journey, during their IVF, they have to have a drip that actually lowers the level and calms their natural killer cells down to allow their body to actually accept the pregnancy and to be able to develop the baby. That can also be the case if anybody has lots of early on miscarriages. So there can be lots of factors. So, and a lot of things that your clients won't know about. Natural killer cells, it wasn't something I was aware of until probably 4 years on the journey. The microbiome was 3 years into the journey. So if you start to think that's a long time and a lot of emotional build-up before even finding out certain causes. So yeah, so it's really good for you to have an overview and an understanding of potential causes so you can better advise your clients, or maybe say to them, have they investigated this part? Have they investigated this? Just so you can support them. Okay, so what does treatment of IVF look like? So every month a woman's body will stimulate follicles. So these are fluid sacs within the ovaries, and these sacs potentially can carry an egg. So each month, within the first 14 days of every woman's cycle, the body releases hormones to stimulate these eggs, called ovum. As the eggs get bigger, the follicles can be seen to grow on a scan. So when this person has an internal ultrasound, the physician will be able to start to see these follicles get bigger in size. The quicker and larger the follicle sometimes means the stronger the egg and the better the quality. Once these follicles, so these fluid sacs, have reached around 21 to 23 millimeters in size, the ovum is classed as mature, and the body will release the signals that are sent to the pituitary gland, and the pituitary gland will release HCG hormone, and this stimulates that egg to release from the follicle. So that follicle will hatch and the egg will be released. Normally, in a normal cycle, a woman will, within one menstrual cycle, they will release one follicle. The aim of IVF is to stimulate multiple follicles, maturing multiple eggs within that 1 month cycle. So IVF doesn't reduce your egg count. It simply tries to make it better use of the eggs that your body has released that month. So that's really important to understand. What is IVF trying to do? So it tries to mimic that first part of the journey. So you work alongside your clinic, and your clinic will prepare your medication protocol, and then you would wait for your period. So you have all the preparation beforehand, you have these scans to see what your follicle is, follicle sizes are, you have to see how many follicles you're producing, maybe different tests at the start, and then you would sit down with your clinic and they would say, based on the information that we have from you, this is your medical protocol that we're going to put you on, and then that person would wait for their period. So on day 1 of that period, they would have a scan to make sure that they had no cysts and to make sure that it's safe to start drug stimulation. If the person does have a cyst, the cycle the IVF cannot continue, and that means because if they were to use drug stimulation, it could stimulate the cyst and can even burst the ovary, so it can be really damaging. So I've had that happen as well, where 1 month I had a cyst and we had to cancel treatment. So you have a lot of build up, a lot of preparation, and then you can go to the clinic and just be told that it's, you can't try, you have to wait until that cyst goes, or if it was worse, have it operated. Cysts can take around 3 months to grow. So 3 months to go. So if you think there's somebody on this journey, that 3 months can be a long time. So once you've had your scan and they've checked that you've got no cysts and it's safe to start your drugs, from day 2 onwards, you'll start your drug stimulation. This is just a typical IVF process. A lot of cycles can be completely different, but this is just to give you a base understanding. So the drugs that the person would be using would be FSH and LH stimulation. This is normally in the form of injections into the stomach. Alongside this, they will take an ovulation suppressant, so a drug that suppresses the body from stimulating HCG and releasing those eggs. So they'll take a drug to stop that process. All clinics will, like I say, will have different protocols. Some will take this before, some will take it during, and some clinics also offer blood thinner injections. Due to the hormone medications, it can have a bigger clotting factor within the blood, so they often need a blood thinner to go alongside this. You will have multiple scans during this time as well to make sure that the body is responding to the drugs and that is in fact actually stimulating multiple follicles. If it doesn't happen, then sometimes, like I say, the cycle can be cancelled. If somebody's body is not stimulating to the drugs, and if their body is not producing larger follicles, then it can be cancelled again, which can be really upsetting for somebody when you've gotten on that journey, you're injecting, because a lot of people will put a lot of hope into IVF and it doesn't necessarily mean that they will have a baby at the end of it. Between days 10 to 14, once the follicles have been seen big enough, the person will then take a HCG shot. 36 hours later, they will then have an operation under sedation to extract the eggs from the ovaries. And sometimes the drugs can be too strong and people can get hyperstimulation, where their follicles are too stimulated. The ovaries are large in size, and they can become too big that it can cause the person a lot of pain, a lot of discomfort, and a lot of additional symptoms with that as well. and it can even cause your ovaries to twist. So it can be quite dangerous. So it's really important that the clinic put you on a protocol almost to allow your body. So when I started after a first round of treatment, I was on quite a low protocol. And as time's gone on, I've got my protocol has gradually increased. So my body can get used to it more, which I think has worked quite well. The operation is a quick procedure and the needle doesn't enter into the uterus, it just enters into the side of the vaginal wall. Once collected, the clinic will tell you how many eggs you've got, say for example 10. Then you will see out of the eggs that they've retrieved from the operation, how many of those eggs are actually mature. So they will look at that. So the number often reduces. Then they need to look at how many of those eggs actually fertilise once they're put with the sperm. So that could maybe then go down to 4. And then they need to see how many of those 4 fertilised eggs that they've got then reach what we call a 5-day stage. Yeah, and often that can be 2. So somebody can start off with 10 eggs and within 5 days they've then got down to 2. Some people can start with 20 eggs and only get one fertilized egg from it. So you have to also think of that psychological impact of that. And, you know, almost preparing your clients that those numbers are likely to go down. So the better prepared they are, the less of a shock it is to the body. Once the egg and sperm are put together and once the egg is fertilized, it becomes what we call an embryo. Okay, so that's how many embryos do they have at that stage. So at the start, you've got an egg, you've got sperm. Once they come together, that's then called an embryo. At 5 days, this embryo, the cells start to divide and develop. 5 days, the cell development then becomes what we call a blastocyte. And it's that blastocyte that helps us determine the quality of what potential of the treatment working. So what they often do is the clinic will grade that blastocyte to see, or blastocyst to see what the grade is, to see how lucky it is, you know, what is the potential of that one likely to happen. So that can grade anywhere from an AA being the best and CC being the worst, or D, they discard it. So people can get babies from like BC, CC, it can happen, but the percentage of the success rate dramatically reduces. So that's something to, you know, for you to be aware of in your clients. So obviously the better the grade, the better the potential outcome. So day 15 to 19, the 5-day-old blastocyte is then placed back inside the uterus. The woman has been taking progesterone within that 5-day period as well, normally in the form of a suppository, and estrogen tablets to mimic that pregnancy experience. And this can help the lining to be more receptive to that embryo when it's put back in. The procedure is quite quick and the woman is awake and can often see what's happening on an ultrasound. There is then what we call the 2-week wait, which is that dreaded 2-week wait where the client can't do anything in that time. Well, limited number of things. The physical activity needs to be reduced and it's a waiting game. Waiting to see if the embryo is accepted by the body and if the embryo can implant into the uterus lining. The embryo cannot survive if it doesn't implant, as it needs a blood supply. So IVF can only control the above, what we've been through. It cannot control, it can only control that first part of the process. After that, it's then down to the body. The body has to be able to develop that embryo and carry that baby full term. So like we said, it's going back to those 3 factors: the egg, the sperm, and the environment. Okay, the IVF can get great sperm, great egg, but if the environment's not right, it may not lead to a baby. There are many factors that can affect this process, and every stage there are hurdles to get over. So just because someone's doing IVF doesn't mean that they're going to get pregnant. There's different terms there that I've also put. IUI is where they will inject sperm into the uterus, maybe sperm that's a little bit more sluggish or lower in numbers, and they try to get the sperm closer to the egg. So that's often a factor called IUI. And then ICSI is when the scientist actually picks a single sperm and injects that directly into the mature egg. There's other terms that I've put to the side there as well. BFP, big fat negative, AF, aunt flow, and BFN, big fat positive, 5, and it's 5DP, 3DT, which means 5 days post, so 5 days after the transfer's happened, after a 3-day transfer. So some embryos are put in after 3 days and some embryos are put in after 5 days, depending on age, quality and growth. So some embryos are put in after their 3-day growth and some are put in after 5-day growth. So that just determines how many days did the operation happen and after how many days did it happen. So like 5 days post after the procedure, and how many was it between the eggs being extracted and the eggs being put back in. I know it can be a bit of a minefield, but it's just to give you those little bits of an understanding when you read these things, or the terminology that clients will use, you feel that you have a better understanding. So what can we do to better support our clients? First off, like I've said, the situation isn't comparable, but the emotions are. So if you wanted to have, like I've put in the list below, empathy, try to focus on any of the emotions that you might have experienced at different times, because that's going to be more relatable than potentially sharing your own fertility experiences with your clients. I always like to share my own personal experiences, but in this situation, I think it's a lot better to share to compare emotions rather than situations. Ask the question. It's really important that you ask your client what they feel, what would support them. I have had some people say that they don't want to be treated any differently, and others saying that they really want that consideration. So really just asking them, what can I do to better support you? What helps you to feel less triggered, and what can I do? Research as well. I have had one of my counsellors that I have that has seen me throughout the whole of this journey. I didn't start actually going to him for fertility, with fertility. It was other situations, and then fertility developed from that. So he didn't actually have any experience within that. He actually started to research it, look at the emotional impact, read books on it, just to try to have a better understanding of that impact that it was having on my life. And that knowledge is key. So I think that's really good as a therapist, if you do have clients that, because it is such a minefield of a journey, start to do some research, start to have a better understanding. Listen and be their support. One of the main things clients will say is that they struggle a lot with loneliness and just not feeling understood. Having a community around them and a support network just to listen and carry you through those hard times can be really fundamental. Listening is such an art and so crucial in being a successful therapist. Giving no advice, no recommendations, just listening. Check-ins, letting the person know that they are thought of. And say, for example, if you've got clients that haven't had a successful round, or they've had bad news, bad results, or they've been really triggered by a pregnancy announcement and they're having a really hard time, just let them know that you're thinking of them. You don't need to necessarily dive into how they're feeling, because they may not even be able to process those emotions themselves at that time, but just let them know that you're there and you're thinking of them. Empathy, we've already touched upon that, and the art of touch. Your skills of being a therapist and using touch will really benefit somebody just to feel really cared for and feel loved. If we go back to that factor of worthlessness, there's nothing better than somebody just really wrapping you up, caring for you, and really benefiting from that mind, body, soul element connection. Just a brief on what not to say, so I think this can be really important. Just relax. It's the worst thing that you can say to a client on this journey. You wouldn't say it to a cancer patient. Just relax and your cancer will go away. Just relax and it will happen. It can be, a really bad trigger for somebody. Maybe you should adopt. Some people just aren't meant to be parents. Things like that just isn't helpful, because that may be how you might perceive the situation, but not how somebody else is going to perceive the situation. And I think a lack of understanding has a lot to answer for, because it may be that the person just wants to keep trying, but a lot of people think, oh, they've had a failed round, it's never going to happen for them. Maybe they should adopt, but that doesn't mean isn't always the case. I've known people to have 10 rounds and get a baby at the end of it. It's about encouraging them to what they feel is right. As long as they've got hope, then the journey will continue for them. It's when they can become completely hopeless that the journey, they may not want to continue, whether unless they're told by their practitioner or their doctor that their body isn't going to do it, or whether they mentally can't get through it. It's one of those, whichever one comes first, I guess. At least you have one, so it could be secondary infertility. At least you've got one child. Not a positive thing to say. My husband just looked at me and I was pregnant. So many people, it's not intentional, it's just how it happens. But it's things like that people just don't necessarily understand the impact. Oh, I know how you feel. It took me 3 months to conceive. Like we said at the beginning, the emotional impact for somebody on a journey over 2-3 years plus is going to be a lot more detrimental than somebody that may have been trying for 3 months. I understand how you feel. Unless you've been through it, it's really hard to understand how the person may be feeling. You can say, I've been through a situation of really deep grief myself. So, I can't imagine how you're feeling, but I know how that felt for me. Saying something along those lines. Oh, don't worry, you're still young. Again, can be a real trigger. And on this journey, time really flies quickly. So, time is of the essence. Not that somebody needs to rush the process, but it's just not helpful to say you're still young. You're too stressed. Infertility causes a mass amount of stress. So really, we don't just need to look at the stress that the person may have had previously, but actually the stress from the experience. What can we do to help that stress? Do you really want a baby? Why do you want a baby? It will just happen when you least expect it, and stop thinking about it. Again, just isn't helpful. It's like saying to somebody, oh, if you just stop thinking about having cancer, it will go, which isn't the case. Asking if somebody has children as well, just even asking if somebody has children can sometimes be a trigger for somebody, because it's not something like age can be a trigger for some people. It's just not something that we really need to ask. Putting that person in a situation when we don't understand their situation. When not to treat our clients. So the aim is to support our clients and help them to heal, help them with that emotional side. If they have a baby out of this process of us working with them, then that's great. But our focus is just to help their healing, help that stress levels, help the emotions, help the physicalities of what's happening within their body. I would recommend that you see somebody for 3 months prior to them potentially having treatments to help boost their mind, body and soul before treatment. There's something really important about the 3-month cycle and 3-month preparation. It can take 3 months for an egg to almost be mature enough to be released from the ovary. It can take 3 months for new production of sperm to happen. So there's something really key about 3-month cycle. So often when I've had my successes, it's been when I've been working with clients on a weekly basis for 3 months. And it wasn't until being on this journey myself that I realised that importance. And there's particular clinics as well that actually put people on a 3-month mind-body awareness program before they were even able to have IVF. So try to work with your clients on a weekly basis, if at all possible. Work with them on that 3 months. Someone says, oh, I'm going to be having IVF. Okay, start to work with their body up until that process. what can you maybe recommend, or what can the person be doing in that meantime, in that preparation time? So they could be doing blood tests, hormone checks, ultrasounds for follicle count, and blood flow is another really crucial factor. Getting blood flow to the uterus. There's particular scans that can help to see the blood flow to the uterus lining. Their partners can be doing sperm tests, things that they could be doing themselves, maybe becoming a bit more aware of their pattern, more attuned with their bodies. Education and awareness, they can start to just learn a little bit more about the process. Certain books that may be available, ones that I really recommend are from Zita West. She is an acupuncturist and has her own fertility clinic in London, and she's written lots of nutrition books, lots of educational books as well for couples, so people can start just to do that. If they're private, then it may be that they want to work with their client as well. Don't be afraid to ask questions. There can be a long wait with the NHS as well, just to make them make your clients aware of that. Or if somebody is saying to you, I'm going to be approaching the NHS for fertility, then they may want to try and start that process as soon as possible, but you've got a nice time to be working with them to try to get them ready for that process. Tips for mind, body and soul. So Dr. Ali Dorman is a world-renowned harvest scientist and scholar who has devoted her career to helping couples through infertility in a better way, and helping them to actually have more happier results and more pregnancies from working with psychological impact of it. By helping their psyche, they have better results. She actually has done proven scientific tips to help the mind, body, soul to navigate through this journey. And these tools and these strategies have been proven, like I say, science-based, to boost the chances of pregnancy rate. But this is also with natural pregnancy and assisted fertility as well, by improving the psychological and physical symptoms. So that could be to empower your clients, help them to feel empowered to put themselves first and do what's right for them, not their friends. Don't go to a baby shower. Dr. Ali would say, with one of her groups, someone said, oh, I've been invited to a baby shower. She says, why would you put yourself through that? And that really struck with me. Yeah, why? Put your own needs first. Empower yourself to tell people how you wish to be told about expected pregnancy announcements. I've texted friends to say, if and when you are pregnant, I'd really appreciate it if you could please tell me via text message. And they've done that, and that's been a lot easier for me to process in private rather than being told and being put on the spot. Yes, those situations still happen, but if we could try to use preparation tools to help that person with the different triggers that they're going to be getting in their life, this can be really beneficial. So communication with partners and family and people around them. 99% of people would rather be told by text, like I've said. So, telling people around you the best way for them to communicate with you, to just ask you to check in on how you're feeling. Do you want to talk about it? Do you not want to talk about it? I've said to my friends now, unless I bring it up, don't ask. I don't want to be put in that situation where I feel like I have to tell you. So just having the confidence to communicate that. Journaling can be really good as well, writing down how the client is encourage them to write down how they're feeling, and it's also a good reminder of where they've come from. We've kept a diary, just actually like a fertility journal, of this whole journey over the last 5 years, and actually now reading back about, God, look at where we were. You can see how much you've really grown. So that can be a really good preparation to just help with different triggers as well. Different coping strategy, helping to have a plan in place, help the person to get over a negative result. So a step-by-step plan of what it is that they can do to even just get out of bed. So my plan would be something like, if I have a negative result, or a negative test result, as in I've had a blood test and it hasn't been the result that I wanted, I will say to myself, okay, I will allow myself 2 days of being able to not get out of bed and cry. Right, on that third day, I'm going to move my body. I'm just going to go out for a walk. Or I'm just going to take a shower. Okay, and then after that process, I'm going to try to analyse the situation, then reflect, and then action. actions way down the line. They don't want to take action straight away. They want to process those emotions and allow their body and mind to release those emotions rather than straight away going into the next plan, because it's just going to come out later on. Remember that who you were before. So it's really nice for clients to just be able to check in and go, who was it before I was on this journey? What were my drives? What were my motivations? What were the things that I was ambitious about? And actually going back to that, because those are potentially the things that they may have more control over, whereas infertility is something that they don't have control over. So these are just tips that you can potentially work with your clients and work with them to just, to support them on this journey. So other tips that I've written down here as well. So I've tried to separate for soul, mind and body. So soul would be, you could recommend potential affirmations for them and make sure that they have different positive wording within those affirmations. Meditations, gratitude practice, to be really thankful for what they've got in their life right now, because that can just really help them to feel a little bit more grounded rather than looking in their life of what they lack, looking at what they have. Aura cleanse can be fantastic as well. So if you know any practitioners in your area that are doing aura cleanse, can be really good to help to refer your clients for an aura cleanse. That pain that I mentioned earlier on, when I used to cry after an aura cleanse, it completely disappeared. And when I cry now, it's more surface level than deep rooted emotion. Reiki healing as well, like I said, can take some of that deep rooted pain as well. Pain away, and just journaling day-to-day life. You can get different journals that can help, like gratitude journals or different reflection journals that you can work through. There's different crystals as well. Rose quartz can be really good. It can be really nice just to gift your clients a rose quartz crystal, before they embark on their IVF journey. Manifestation as well, helping them to really write down what they truly desire. There can be different colouring books as well, we can really help with manifestation, just really helping the soul. With all of this, there's an absolutely fantastic app that I would recommend that you'd recommend to your clients. It's called My Fertility Toolbox, and it's part of My Fertility Hub, and it's an app that actually provides mind, soul and body techniques to people on this journey, and different podcast conversations with different professionals that can be really beneficial for them. It's got guided meditation practice, actually for waiting room meditations, actually post-transfer, pre-transfer, 2-week wait. So they've got all of the meditations to help guide them throughout that process, and it can be really good. Mind techniques, breath work, getting them to focus on deep abdominal breathing rather than chest breathing, that can be really can cause a lot of anxiety. Different community groups, if you know of any in the area. Changing social media as well. On Instagram and Facebook, there's a button that you can click. It's got 3 dots in the corner of a particular post that you don't want to see. So, I would have lots of fertility or baby related posts coming up, and it would just be too triggering for me. So now a lot of mine's food that comes up, but I would actually click on the pregnancy post or pregnancy announcement post and click on it and say, I don't want to see this. I don't want to see anything related to babies, pregnancy, and that can just really help somebody's mental health. Walking, moving the body can really just help to move those emotions and really stop that mind from just going off on a tangent. Hobbies, helping them to have different hobbies and positive aspects of their life outside of fertility. Reading can be good, baths, relaxation. Having things to look forward to is really important, different breaks away, other motivations other than pregnancy and children. The My Fertility Toolbox app, counselling as well. I have counselling every month, even if I don't feel I need it, because it's such a stress within my life. Sometimes you don't really know how you might be feeling, so it's really important to just get that emotional support. So recommend maybe some counsellors or the counselling directory to your clients. Eliminate other stresses in your life. There's so much that there's only so much you can cope with. So eliminating other stresses, what else is people dependent on them? What else is going on in their life that they could potentially eliminate to be able to cope with this journey? And it may be that they need to on the short term take a lot out of their life. It may be that they can actually start to gradually add things back in as they build up their strength. Moving your body is proven to move your thoughts. Self-abdominal massage, showing them some techniques that they can do to massage their stomach. And it's just really good helping them to just connect with their uterus and their body, and almost sending them self-love. That can be a really nice thing to do. Diet, reducing sugar intake, natural probiotics, or increased good fats is really important, or maybe recommending that they see a fertility nutritionist. So somebody that specialises in fertility, especially if they've got like polycystic ovaries or endometriosis, I would really want to focus on a nutritionist for those particular clients. Supplements as well. Pregnaplan is really good. A probiotic supplement that I would recommend is OptiBac Women. That is the one that I took that helped me to balance out my own microbiome. So that is one that I'd really strongly recommend. CoQ10, again, another really high go-to supplement that I'd recommend that they take. And it really helps the egg quality, and it can help sperm quality as well. So all of the supplements that I'm recommending, apart from Pregnaplan, you get that from Cytoplan. The Q10 probiotics, vitamin D, iron and omegas, I would get from Zeta West. So if you just type in Zeta West, like I say with her book, she also has her own supplement range. Exercise, light or gentle exercise or intense exercise, just something that's going to get those good endorphins going. Yoga as well can be really good for those meridian lines. Maybe other professionals or other therapists having acupuncture alongside treatments that it is that you offer. Essential oils as well, maybe recommending different essential oils to them. Make sure that they drink plenty of water, especially if they're actually undergoing IVF. As the ovaries get bigger, if you think that they're fluid sacs that are holding those eggs, they need more fluid in their body. And the hormones are going to be using up more fluid as well. Plenty of sleep. Sleep is a healer, so that can be really important, especially for sperm quality and whilst you're undergoing treatment. And avoiding toxins where possible, such as alcohol or smoking. So I hope that gives you just a brief insight into the research and the impact that infertility has on somebody, the impact that it has on their overall life, potential spiritual growth or development, potential triggers, what not to say, what an IVF journey could look like for somebody that's undergoing treatment, what it is that they actually will go through, and how you can better support your clients by just having that awareness and that understanding, and having some key techniques that you can encourage them to do to support them with those triggers. And like I say, working more on the emotional impact as well as maybe just physically just relaxing them and helping them on a physical level. But like I say, just not comparing any physical experiences and comparing emotions to help you to have better awareness. Infertility doesn't just stop once a client gets pregnant or decides another route for them. It continues during that pregnancy and can even continue 10 years down the line. Like we said, it can become post-traumatic stress disorder. So if you have clients that have been on that journey and have overcome it, they can still be still having a psychological impact from it as well that you may need to be supporting them with. But remember, reminding your clients that it doesn't last forever, and there is an ending to all of this. Whether it is that they have a child, whether it is that they fully accept that they will be childless, or they go around the route of adoption, eventually that process will end. You will find acceptance for whatever the situation is, and I think that's the goal, is acceptance of whatever the situation is, and really helping your clients to get to a point of acceptance. I really hope that you found this useful, and I really hope that it has impact with your clients that you support on their infertility journey. Thank you.